Hi guys, welcome back. Registered Nurse Ben is here. Good news family, good news family. I can't wait, I'm so excited to share this with you. So I'm not just a registered nurse now, but I'm also a registered midwife. So you address me as registered nurse, registered midwife, brains. More degrees, more license added. We are loaded. We are going forward. I'm excited. So on today's video, we'll be talking on how to study better as a nursing student. Right now, I'm talking to you as a superior nursing student. I'm now RN, RM. Shout out. So how to study better as a nursing student? So if you're watching this video, you are probably 100 level, 200 level, 300 level, 400 level, because the most dreaded exam for nursing students is the nursing and midwifery council exam. So how best do you help yourself to study to achieve success in this exam? First things first you need to do is to have a timetable for yourself. Know what works for you, know when to study, know when not to study. Now let's bring it down to to how the general lifestyle of how people study in the university. In the university, you see a lot of people going for night classes, a lot of people studying at midnight, waking up by 12 p.m. The question you should ask yourself is, does this style actually work for me? Be truthful to yourself. When I'm studying at night, am I actually studying, or I'm using 2 hours to sleep and studying for 30 minutes? Is it effective for you? Because Emeka, Jumbo, and Nkechi are studying at night, and like majority of your friends, Nneka, everybody's studying at night, does not mean you should join the crowd and do what doesn't work for you. Be realistic with yourself. Most of the times, like personally for me, studying in the morning is best. I can't function once it's past 12 or 1 o'clock. I literally be shut down. So have a timetable for yourself. Know the appropriate time that works for you. Know when is the best time that your brain functions. If it's in the morning that works for you, after morning devotion, or when you wake up from sleep, I literally sleep with books by my side. So the moment I wake up, the first thing I do is to pick up that textbook that I plan to read and just start reading. If it's in the afternoon under the hot sun that you assimilate better, fine and good. If it's in the evening, the cool of the evening from 6, 7 when you are woken up, and then you assimilate better, fine and good. Don't join the crowd. Don't follow someone that reads in the morning when you actually read at night. Don't follow someone that reads at night when you actually read in the daytime. So if you know you cannot read at night and you are following your friends, trust me, you're just wasting your time, and in no time you will actually not achieve good success. So also, getting a reading partner. If you know that you can't read alone, you will not be consistent. So people are not solo readers. Why? Most of the times you literally have to try the 2 types of reading to know where you fall under. For me, in my 100 level days, 200 level, 300 level, I was literally reading alone. I was a solo reader. So you need to find what works for you. And then for council, for nursing council, we have so many people achieving the same goal. I had to read with people, and I found out that when I was reading with people, I cover faster than when I was reading alone. Do you understand? So know what works for you. At the same time, there are people that literally cannot read with people no matter how they try. So if you feel, if I read with my friends, not the one that you may gist to. If I read with my friends, we read, we talk about it just like we are gisting to stick to my head, or I need to actually communicate. Or even like teaching people when you are done reading, it will help you, my dear. Do it. Do it to back that degree. Do it to achieve that license. Okay? Knowing what? Then get recommended textbooks. Not everything you see online that you will use in nursing. The textbook that were recommended, they are recommended textbooks in nursing. Read the recommended textbooks. Then also read books that are simplified, nursing books that you can understand. For instance, the book Popular Bonus and Students, not everybody can understand it. I'm a lover of textbooks and I have a lot of nursing textbooks in my collection. But trust me, I cannot read and assimilate all of them. So if Bonus and Students you can't assimilate Bonus and Students, don't waste your time reading it. If synopsis is what you can assimilate better, or is what you are comfortable reading with, my dear, read that. And if that is what is recommended, or that's the textbook your lecturer is using teaching you, read it. Because don't depend on Wikipedia materials, because the lecturer that set questions up did not get questions from Google. And okay, let me use this example. Respiratory rates, for instance. Respiratory rates in a particular textbook can be 16 to 20 beats per minute for an adult. You can see on Google, you'll be seeing like 12 to 14 beats per minute for an adult. So it varies. So use the recommended textbook that your lecturer has given to you to achieve success in your exam, because you will not pass an exam with a material that was not given to you. Although this is health and many things are broad, but then when it comes to figures, it differs. So I would suggest that you use the recommended materials that works for you. Now, attending lectures. If you're the kind of person that you remember what was being taught, please don't skip lectures. Don't join the people that are skipping lectures, because some people, no matter how they miss classes, the moment they carry their book to read, they assimilate better. For me, I don't do well with evening classes, like classes that are holding from 4 to 6. I literally shut down during evening classes. And if I really don't want to attend this evening class, and my friend John Boone or my friend Nneka also doesn't want to attend this evening class with me, whereas she tends to remember what the lecturer says, she'll be doing herself more harm than good, compared to me that I can literally sit down and assimilate whether I was in the class or not. Then, so I will advise, know what works for you, understand yourself, because you get to school alone and it's your name alone that will be written on the license. In this way, you are able to study better and achieve better. Getting nursing apps on your phone, doing a lot of quiz on a particular topic, and going wild in your textbooks, going wild in recommended materials, like recommended trusted materials for nursing. There are a lot of textbooks, especially for med-surg. There are a lot of textbooks that are recommended for generally, that you can use. Don't use a textbook that is not recommended, so you don't have issues. Also, that you don't assimilate a knowledge that your lecturer will not be happy with. Your lecturer will not mark as fast because they don't know where you got your source from. And if at all you want to make reference to a particular material you read in your exam, you can actually cite down where you got your information from, so that your lecturer can check if at all they have any doubts. Other recommended textbooks that you can see, there is this anatomy and physiology textbook, Rose and Wilson. Rose and Wilson is generally acceptable. The other generally acceptable textbook for nursing and nursing students. Med-surg, synopsis is acceptable. Bonus and Sudas, although you need a nursing dictionary alongside when you do bonus and Sudas, but bonus and Sudas, I will not advise it for beginners nursing students because it's very, very difficult to comprehend. You can use it for reference purpose, but if you are trying to understand the basis of the topic, bonus and Sudas, trust me. You can use acronyms. You can use acronyms while writing. You can use acronyms like nursing rhymes, because one word I keep using med-surg because med-surg and pharmacology are the most dreadful subjects that nursing students have issues with. So, for instance, now we are talking about pathophysiology of a disease or pathophysiology of peptic ulcer, and the pathophysiology that we are having here is about 10 points, and you literally cannot remember all. Use acronyms to remember them. Maybe you pick the first letter of each of the sentence and use acronyms. In that way, you are able to remember everything that you need to write. Now, how to answer exam questions, because it's one thing to read, it's another thing to answer your exam questions properly. A lot of lecturers prefer their exam questions to be answered in highlighted points. This is not secondary school where they will say write an essay or in less than 350 words write this thing. So we want you to write for lecturing. A lot of your lecturers prefer you highlight your points during an exam. Like, for instance, you are asked to write on the anatomy and physiology of the stomach. Now, how best to answer this question is to highlight your points. The lecturer don't have to start looking for your points. First of all, you write the heading anatomy and physiology. Then you highlight it, you either give a bulletin or you just highlight your point. You start, okay, write shape. Then the shape is so and so. The right color. The color is so and so. The size is so and so. Then macroscopic view, you write. Microscopic view, you write. In that way, the moment the lecturer carries your script, they are able to see exactly what they are looking for. They write the pathophysiology, the nerve supply, the blood supplying these organs, like the stomach is divided into the cardiac, the fundus. You write every single thing, like point by point, not congesting it like we are writing an essay for like a primary school student writing an essay like my name is so and so, I am here to write so and so. In that point, your lecturer may not be patient enough to view your point, and a lot of people have bad writing. The moment your points are congested, the lecturer cannot understand it. They are impatient. A particular point, you may make a particular point, but because it's congested, the lecturer may not even see it. They may not award the points there. They may not give you the points they are supposed to give to you because your point is not well stated. So that is how best to answer exam questions. When you write your questions like that, you can even end it with the functions. You write them, highlight your points and bullet it. The lecturer sees this point. The moment they open your script, your work is well aligned. They know that yes, you know what you are doing. They know that you know what you are doing. So I hope my tips, when you actually do this, I hope you find my tips helpful. please, if you find these tips helpful and useful, and then you use them and you try it out and it works for you, please share your testimony down there in the comment section. And you can also tell me about your experiences. You can also tell me what works for you best. Give me examples on how. You can also give examples on how you are doing what was not working for you and how you actually realized what was working for you, so that other people can learn from your testimony and help you achieve your goal. So talking to you here is registered nurse and registered midwife Bernice. See you in my next video.